The Center for Health, Human Rights and Development, in collaboration with the Ministry of Health, has inaugurated the Uganda National Conference on Health, Human Rights and Development with the aim of enhancing the delivery of healthcare services.
Law is very critical in the promotion of health and good and well-being. And law is what one can call a double-edged sword. It can be empowering and disempowering. For example, you can have the Public Health Act, which Dr. Olaro has talked about, which promotes good health.
The Director of Curative Services at the Ministry of Health, Dr. Charles Olaro, says there should be universal coverage for all, with people accessing health services without financial services.
So whereas the government has made progress in all addressing all those, and we have had some improvement, but they still remain a challenge. So why this conference is that the challenges call for a sustained collective actions across all sectors.
Olaro conveyed these comments during a press conference held in anticipation of the Uganda National Conference on Health, Human Rights and Development, taking place at the Ministry of Health headquarters in Kampala.
However, the sector continues to face persistent challenges which threaten the country's realization of SDG by 2030. We have just had COVID. However, there are also systemic and structural challenges within the health system, which are coupled with a weak and lack of safety nets for most of the vulnerable to continue to exist. The high maternal mortality rate, the high HIV prevalence and sexually transmitted infections, increasing cases of teenage pregnancy, with the related vulnerabilities such as unsafe abortion and gender-based violence continue to be of concern.
Center for Health, Human Rights and Development, in collaboration with the Ministry of Health, has organized a national conference on health, human rights and development.
You cannot separate health from development. It's a development issue, and it has to be given attention. So a conference that enables us as Uganda government, as Uganda academia, as Uganda researchers, as Uganda civil society, as Uganda communities that are beneficiaries to health services, to discuss how can we harmonize, how can we give attention, equal attention to health, human rights and development, is an important space and platform. So this is the conference that we are organizing.
So you find a lot of gender things emanating from culture, shape what people eat, how people behave, who they should marry, how many children they should have, and these things have an influence on how people's health are.
Sudat Kaye and Dokas Kimono, UBC News.